Good afternoon, and welcome to the 2022 Gibson Lecture. My name is Keith Banting. I'm a retired faculty member in the School of Policy Studies, and I will be your host and moderator for our session this afternoon. I would like to begin, as is now our tradition, with a land acknowledgement to acknowledge that Queens is situated on the traditional Anishinaabe and Haudenosaunee territory, and we are grateful to be able to live, learn, and play in these lands. Let me begin with a few words about the Douglas Gibson Lecture. This lectureship was established in 1988 by the family and friends of Douglas Gibson in honor of his memory and in honor of his many years of contribution and service to Queen's University, most notably his period as chairman of Queen's University's Board of Trustees. The family was an important contributor to this scholarship series, or lectureship series, and we're honored today to have several members of the Gibson family with us. And I'd like to give a special warm welcome to his sons, Dan and Doug Gibson, and to his grandson, Edward Gibson. Welcome to you all. The Gibson Lecture was established to bring to Queen's University a distinguished researcher or recognized public figure to present a public lecture on issues that were central to the mandate of the School of Policy Studies. Over the years, this series has brought many distinguished lecturers to this university. And once again, we are extending that tradition with our 2022 Gibson lecturer. Today, we welcome Professor Melissa Kearney as the 2022 Gibson lecturer. Dr. Kearney is the Neil Moskowitz Professor of Economics at the University of Maryland. She has an immensely impressive CV, and she's a widely respected scholar who is centrally located, centrally placed in the networks, the research networks, and the policy networks in her field, in economics generally, and in the particular area of her research expertise. She is a director of the Aspen Economic Strategy Group. She is a research associate of the NBER, the National Bureau of Economic Research. She has been, or is, a member of numerous editorial boards on important journals in the economics profession, including the American Economic Journal, Economic Policy, the Journal of Economic Literature, the Journal of Human Resources. So our lecturer today is clearly centrally placed in the core networks of the economics profession in the United States. But when you look carefully at her resume and you look carefully at the sort of networks in which she's engaged, there is another theme which emerges strongly, which is the theme of a scholar who wants to bring high quality research to bear on contemporary social problems. So one sees that Professor Kearney is a senior fellow at the Brookings Institution, and for several years was the director of the Hamilton Project. For those of you who may not know the Hamilton Project, it was an important effort over time to develop economic policies that not only stimulated economic growth, but also tried to ensure that the benefits of that growth were shared more broadly in society, that there was a wider spread participation in that growth than had hitherto been the case. Dr. Kearney is a senior affiliate and a member of the board of governors of several research organizations at other universities that focus on similarly important social issues, focusing on economic opportunities at Notre Dame and the Poverty Action Lab at MIT. She also serves on the board of MDRC, what old timers like me used to call the Manpower Demonstration Research Corporation. She's on the board of governors of the Smith Richardson Foundation, another policy-oriented foundation. And she's co-chair of the JPAL State and Local Innovation Initiative, or has been for several years. And the Poverty Action Lab is a global research center working to reduce poverty by ensuring that policy is informed by the best scientific evidence. And so there's a theme here, or there are two themes: quality research, engagement in important social issues. And that duality informs our topic, her topic today. The lecture is Declining Fertility. It's entitled Declining Fertility and Diverging Family Structure, Demographic Challenges Unfolding. Now, I have to confess that earlier I asked Dr. Kearney why she had wandered into this particular area of research, and she laughed. And I have to tell you, she laughed because apparently if she's giving a lecture in an economics session, no one cares why she was interested in this topic. Whereas in policy school, she's always asked, well, how'd you get interested in this? Well, the School of Policy Studies is policy school. And so I fulfilled the expectations by asking. And clearly this is the interest in social policy challenges is a long-standing one. As a graduate student, Dr. Kearney volunteered and worked with low-income mothers. This was happening in a very dramatic period, the period of the restructuring of welfare programs in the US in the 1990s, and the quote-unquote ending welfare as we know it with the replacement of aid to families with dependent children by TANF, which I think, if I recall correctly, is temporary assistance to families. Well, I clearly should have looked it up again. So this is a long-standing research interest of Dr. Kearney's, and she's going to bring that extensive research over many years to bear. She's indicated she's writing a book on the topic, which is a very non-economist thing to do. And so today we are going to get the benefits of some of the insights that will appear in that book. Welcome, Dr. Kearney, and I turn the floor over to you.
Well, thank you so much, and thank you for that generous introduction. Let me make sure I could share my screen. Okay, so as was introduced, I want to use my time today while I'm with you all to talk about two demographic challenges that I think portend real challenges for economic and social policy, in particular in the United States, which is where my expertise lay, but also in other high-income countries, I believe Canada among those facing these challenges. And I'm particularly looking forward to the conversation that we'll have after I present my prepared remarks. Okay, so I'm going to start by setting the stage and showing the decline in fertility in the US from 1980 to 2022. So the fertility rate is defined as the number of births per 1,000 women of childbearing age. And you can see that for decades, that rate really just hovered between 65 and 70 births per 1,000 women, but it's plummeted since 2007. And we would have expected a decrease in births in this shaded area, the years right after the Great Recession, the onset of the Great Recession. But the surprise has been that births haven't rebounded. And so the US, this is new for us, has been on this downward trajectory in births. Okay, so interestingly, if we put this in terms of the total fertility rate, and the total fertility rate is an expected, it's an estimate of the expected number of children a typical woman would be expected to have over her lifetime, given current age profiles in childbearing. And what we see is this downturn in annual fertility rates in the US corresponds to a sizable reduction in the total fertility rate, whereas now we're converging towards Canada and the UK and the lower total fertility rate of other European Union high-income countries. And so the question that I'm posing is whether US fertility exceptionalism is over. So for a long time, the US was a bit exceptional in maintaining this total fertility rate above 2. And the reason that's so meaningful is because a total fertility rate above 2 is what is needed to keep the native population from shrinking. Okay, and so now the US looks like we're converging to other high-income countries in having a below replacement level fertility. All right, this has been occurring alongside a slowdown in US population growth. So what you can see here is since 2000, the annualized average growth rate in the US population has been steadily declining. Okay, so this is the lowest population growth we've had outside of the wartime period. And what's driving this reduction in the US population growth rate is the decline in births, shown here in red, met with a rise in mortality, which would be expected from an aging population, and flat immigration. So if we're having fewer babies and more deaths, and we're not making up for that with an increase in immigration, therein lies the reason why the US has experienced a slowdown in population growth. Okay, so now if I look at the data from Canada, it looks like Canadian population growth decreased earlier, which makes sense given your fertility rates decreased earlier. And it's basically been flat over the past 20 years, still close to 1%, which is higher than where the US finds itself now. And if I make a similar chart using Canadian data, we can see what's driving this, the maintenance of population growth in Canada. You have flat births, rising deaths, as again would be expected by an aging population. But population hasn't been decreasing the way it is in the US because immigration is on the rise. Okay, so these three factors are really critical to determining the population growth in a country. And as I'm going to talk about, these things matter. They have very important economic implications. Okay, so what is the first set of economic challenges that comes from a lower fertility rate? Well, here we get into economic growth theory. The first is obviously if you have a smaller workforce, you have lower output, okay, a lower gross domestic product. But the real impact comes from having lower gross domestic product per person, okay? And so that might lead to a question, well, if the workforce is shrinking and you're producing less, it shouldn't matter if there's fewer people. But in fact, economic well-being overall and standards of living overall depend on having more people. And the basic insight from economic growth theory here is that more people leads to more ideas. Ideas are non-rival. So for example, if someone creates the internet or comes up with a COVID vaccine, everybody benefits, okay? Millions of people, billions of people benefit. And so having more people and more innovation and more medical advances, that's where we get higher standards of living. So the real concern is that from having a shrinking working age population, we're not only less productive as a nation, but our living standards overall per capita will decrease. And in the US, we're starting to see empirical evidence of this, that a shrinking labor force is leading to slower economic growth. Okay, really provocatively, the growth theorist Chad Jones at Stanford has given us a stark choice or dichotomy. In a world where fertility is declining, not just in one country, but across countries, which is what we're seeing at least across advanced economies right now, he says we could have an empty planet. And the empty planet stands in contrast to the expanding cosmos. So the expanding cosmos scenario is where we have population growth and exponential growth in living standards for that rising population. The empty planet is a dystopian possibility where we have a stagnation in living standards for a vanishing population. And as he explains, from a family standpoint or a woman's standpoint, there's nothing special about that above 2 or below 2 number in total fertility rate. But the macroeconomics of the problem make this distinction one of critical importance. And again, in his words, it's the difference between an expanding cosmos of exponential growth and an empty planet. Okay. Second thing I want to raise, perhaps more mundane, is the fiscal challenges that come from a declining fertility rate, a smaller working age population. And this is the fiscal challenges from maintaining social insurance programs, and in particular, old age assistance programs. Okay, so if the share of beneficiaries, old age, retired recipients, and US disability insurance recipients, as that ratio per workers rise, then we need to either cut benefits or raise taxes. And the US Social Security system is in shaky financial ground. And when I look at their actuarial reports, they actually project that the US fertility rate is going to return to above 2 for no reason other than, as stipulated in the report, the US has always been exceptional in this regard, and there's no reason to expect that the US fertility rate will converge to that of other countries. But as I'm going to show you, and as I've seen in my own data work on this, I don't think that's true. And I think there really is no reason to expect that the US fertility rate is going to come back. So in my preparing for this talk, I looked to see what the situation for the Canadian pension plan was, and it looks like your actuarials already projected this. So there in the actuarial report of the Canadian pension plan, it assumes that the TFR will increase to 1.62, but it's already assumed that it will stay below 2 for a while. And so as I understand it, steps have already been taken in the Canadian system to adjust for the fact that you have an aging population and a shrinking working age population. And this is something that all high income countries are going to have to contend with if the fertility rate continues to decline. Okay, other effects of a potential, of a shrinking population, there's a lot of interesting sectoral implications. So in the US, we're seeing this already in certain areas where fertility is down. Local and state finances and budgeting are affected. K through 12 schools are closing. Higher education is projecting these shrinking entering cohorts in 18, 15 years, and those we should expect to see consolidation in that sector. All right. On the flip side, some people are keen to suggest, well, actually, this is good for the climate. This is good for the climate challenge. This is good for the planet. Okay. Now, I'm not an expert in climate economics, but I will say that from my reading on this issue, it seems to me that most climate scientists seem to agree that the way to address our immediate and impending climate crisis is through reducing per capita consumption and our carbon footprint. So what we really need is technological progress, move to more sustainable methods of production and consumption rather than cutting the population. Another way to say this is that in the near term, the climate challenge needs to be dealt with in the next decade, and the amount of population decline expected from fertility declines is not going to solve this challenge for us. Okay, so why has fertility declined? So this is an important question because this is what we need to answer to figure out, can we expect this to turn around? So here I'm going to lean heavily into research I've done into the US situation to figure out why it looks like fertility has been declining. Okay, the first thing to note is that fertility decline is widespread across age and education groups. So here I'm showing you in the left figure that there's been a sustained decline in childbearing to all women under the age, or all age groups under 30. So this isn't just teenagers, this isn't just women in their young 20s. Everyone under 30, those age groups are all having fewer children. Women over 30 are having more children than they used to, but not enough to make up for the drop in fertility at early ages. It's also the case that both the highest and lowest educated women are having fewer children. Okay, now what this is starting to hint at is that there's not going to be a simple unicausal explanation, because it's not something that's just affecting college grads or just affecting teenagers. Okay, this is widespread. And we see that it's widespread across race and ethnic groups, with the largest declines, in fact, being among Hispanics in the US. Another issue, another demographic way to cut the data is by marital status. And interestingly, it's not as if there's been a large decrease in childbearing within married women or within unmarried women, but rather what's happened is that a larger share of women of childbearing age are remaining unmarried or are remaining unmarried longer. And I'm going to come back in the second half of this talk to focus on this decline in marriage. But married women have more children than unmarried women. And so the decrease in marriage is mechanically, right, since that's true, is mechanically leading to a reduction in fertility as well. All right, the last demographic cut I'm going to show you is that the largest decreases have come from first births. So in the US, what we're seeing is an increase in the incidence of childlessness. This isn't all being driven by people having, 2 children instead of 3 or 1 instead of 2. More women are not having any children. It looks, when I look at the data, that I'm seeing similar patterns in Canada, where again, all age groups under the age of 30 are having fewer births than in the recent past. And again, the looking by marital status was interesting. It looks like in the 90s, there was a fairly sizable decrease in marital fertility rates. Since then, it's been flat. But as in the US, it appears that in Canada, a larger share of adults of childbearing age are remaining unmarried. Again, this matters because married women have more babies than unmarried women. So I couldn't find it exactly for women, but the married share of adults aged 20 to 34 has dropped in Canada from 1986 to 2021 from 35% to 20.6%, which is a very large decrease in the married share of adults of childbearing age. Okay, so it's widespread, it's across demographic groups. That gives us a suggestion that it's not going to have a unicausal explanation, like I can't point to one economic or policy factor. And indeed, in research I've done with collaborators, we are able to reject a lot of explanations that are frequently suggested for the decline in childbearing. So the types of things we've looked at are the rise in the take-up of highly effective forms of contraception, rise in childcare costs, rising housing costs, improved economic opportunities for women, increased student debt, which is a big thing in the US, reduced religiosity. So these things are sort of true that these things have happened, but none of them changed in any sort of sharp way around 2007. Okay, which makes one suspect at the outset that this is the key driver. But also when we look across parts of the US and look across states, we don't even see the aggregate correlations that you would expect. So for instance, in states where there's been an above average decrease in reported religiosity, we don't see larger declines in fertility in those places. In places where we see rising housing costs, we don't see a larger decrease in fertility. So even if these things might matter on the margin for some people, there's no evidence in the data to suggest that these are drivers of the overall trend. Okay. Similarly, we could reject any meaningful role of variations across states in their policies, like how supportive their safety net system is, how high or low their minimum wage is, whether they've expanded Medicaid or public health insurance program. All of these factors combined can account for less than 6% of the decline. Okay, so that really leaves us in the world of looking for a residual explanation for what's going on. It doesn't appear to be reflecting state policies. It doesn't appear to be driven by any of these economic or social factors that are often pointed to. So my colleague Phil Levine and I have suggested that instead what we should do is look across cohorts. And so this shifts us from looking across time and saying, did something change in the environment in the US after 2007 that would have led to this? To shifting our framing of the question to say, what is happening with the cohorts of adults who are entering their childbearing years around that time? And when we plot the data that way, what we see, what I'm showing you here, is that starting with the birth cohorts of women who were born around 1970, moving to those born around 1995, what we see is that each successive cohort of women is having fewer births at all ages. So the first story that this rejects is something that's commonly asserted in the US, which is that the decrease in birth rates is a transitory reflection of the fact that women are delaying births to older age. But while it's true women are delaying their childbearing to older age, they're not catching up. So this is what we see. We see this clear shifting across cohorts such that women are having fewer births at all ages for more recent cohorts. I can also plot this and it's age-specific fertility rates. And I have the data where I've done this in the US and in Canada. And you see the same thing when you look at it this way, age-specific birth rates. So number of births per women, per thousand women of childbearing age at each age. And you see this isn't, in neither the US nor Canada does it look like a simple shifting right to older ages of the distribution. Instead, the age profiles are within the age profiles of previous cohorts, meaning that women are having fewer births and they're not catching up in their 30s, making up for it. All right, so this raises the prospect that maybe the explanation is cohort-based as opposed to year or specific context. And here's the provocative speculative hypothesis that Philomena and I have put out in a recent paper with Luke Perdue, a University of Maryland graduate student. What we suggest is that perhaps this reflects shifting priorities across cohorts. Now, this is much harder for us to pinpoint in data using our usual econometric techniques. Okay, so I'm putting this out there as something speculative that's consistent with anecdotal evidence, some survey evidence, and I think scholars should, ideally look into more and take seriously as an idea. And what we mean by shifting priorities is that it's likely some combination of changing preferences and constraints. Okay, so it's not that all of a sudden having kids made it hard to have a career. Okay, that was always true, but it seems like could potentially be the case that more recent cohorts of young adults, young women in particular, put more of an emphasis on maintaining a career. We also see in survey evidence, young adults put more emphasis on leisure time. All of that comes in conflict with having kids, and it looks like the way cohorts are resolving this conflict in more recent years is by foregoing having children or having multiple children. Right? And that's where the preferences and constraints interact. It's also true that the cohorts that entered their childbearing ages in the 2000s experienced the intensive parenting in the 1990s that most of us didn't encounter in the 70s and 60s. Okay, so we do know this from data that parenting has become much more intensive. Parents are spending more money and more time on their kids, which heightens the conflict with other goals young adults might want for their life. Okay, so what does this imply for the likelihood that fertility rates will rebound? I think it makes it really unlikely because it's not just some policy lever that can be pulled. I also think it has important implications for the effectiveness of pronatalist policies, or put another way, perhaps explains why those haven't seemed to be very effective at turning around declining fertility rates. Okay, so what do I mean by pronatalist policies? Pronatalist policies, whether they are explicitly implemented with a pro-fertility goal or not, they take two forms. One, anything that raises the income of families with children, such as child-specific allowances, baby bonuses, child tax credits, those are pronatalist, potentially increasing fertility. And anything that reduces the cost of having and raising children, so things like subsidized childcare, paid parental leave, those things also have a pronatalist flair. Again, whether or not they were explicitly passed with those goals. Now, many countries have experimented with explicit pronatalist, baby bonus, child allowance type payments over the recent years. There's a lot of empirical evidence on this. My read of the evidence is that direct subsidies for babies or for young children seems to have a modest increase in fertility, but a lot of that looks like it's just a timing effect. So people, once, like in Spain, they passed this universal one-time payment. It looks like there was a sizable increase in births in the following year or two, but over time, it doesn't look like the women in that cohort had more children over their lifetime necessarily. Okay, the second type of pronatalist policy is, again, this type that makes the cost of having children lower. And a lot of this has taken the shape of things that complement work, make it easier for parents to combine work and child rearing. A really interesting fact here is that if you look at OECD data on female labor force participation and fertility rates, in 1980, there was a negative relationship. So countries like Spain had a high fertility rate, but low female labor force participation. Countries like Sweden And Finland had high labor force participation rates among women, but low fertility. By 2019, that's not the case. Basically, by 2019, when I plot this data, I see a vertical line, meaning in all countries, roughly 75 to 85% of women work. But in some countries, you have higher or lower levels of fertility. So it seems that now, rather than the old sort of literature or policy approach, subsidizing women to stay home, probably the more relevant sets of policies will be those that make it easier for women or parents to combine work and childbearing. Okay, however, having said that, empirical studies of things like expanded paid leave, subsidized childcare generally do not find sizable fertility effects, okay? So my bottom line read of this evidence is that it's going to be very hard for pronatalist policies to get high-income countries to have fertility rates approaching or sustained around the replacement level fertility again. Okay, so where does that leave us? If domestic fertility rate remains below 2, to maintain a working age population, to maintain innovation and productivity, countries are going to have to rely on high levels of immigration. Of course, that requires that fertility isn't declining in sending countries, which is starting to happen. We also need to make investments in increasing productivity per workers. So if we're going to have fewer working age adults, then we need to make sure that each one of them is more productive. And that will require investments in education, basic science, innovation, infrastructure, et cetera. And again, at a sort of mundane level, we're going to have to reform the design of our social insurance programs and the funding mechanisms. Okay. I want to shift gears and take, say 10 minutes, I think, is that okay? 10 minutes to talk about a second demographic trend, okay? This one perhaps is even, maybe more sensitive to talk about than declining fertility, but I think is really important. And it's so often, a really important trend that gets short shrift, at least in our public conversations about inequality, widening social mobility, or declines in social mobility, et cetera. And this is the decline in the two-parent family, and specifically the decline in the two-parent family outside the college-educated class. So that's why in my title, I refer to this as diverging family structures. Okay, so let me start by showing you that what's happened in the US since 1980 is that there's been a really sizable decline in the share of children living with married parents. So that's fallen from 77% to 63%. That's a really large decline in 40 years. And importantly, this is not made up for by parents living together in long-term committed relationships in all, in an institution that looks like marriage but isn't called marriage, okay? Rather, more than 1 in 5 kids in the US now lives with an unpartnered mother, okay? Let me show you here that this is reflective of changing family structure of the kids born to moms who don't have a 4-year college degree. So on the left side, what I'm showing you is that the percent of children living in married parents, the top line plots that trend for the children of moms who have a 4-year college degree. It's only fallen from 90% to 84% among that group, which is also noteworthy because the share of moms who have a college degree has really grown. What's happened is the middle education group, moms with a high school or some college, the family structure in which they're raising their children has converged to that of the least educated moms. So now you see this really large family gap by college being the dividing line, where 84% of kids to college educated moms are living with married parents, and less than 60% of kids born to moms without a college degree are living with married parents. Okay, so instead of just a smaller group of economically disadvantaged families having, this as a family structure, now it's really the two-parent families or married parent families has become yet another advantage, if you will, of the college-educated class. And so the companion figure, what I'm showing you here, is just the reverse, showing that the percent of children living with an unpartnered mother has converged for high school graduates, women with some college, to the least educated women, where it's the children of four-year college educated mothers who stand apart by by having such low shares living with an unpartnered mother. Okay. Now, in the US, I'm showing you that this college gap exists within race and ethnic groups. So there have long been differences in the family structure of white and Black children in the US. There's a long scholarship on this. But what's happened in the past 40 years is this widening divergence by education class. So you see this now for white children, for Hispanic children, and for Black children. Notably, though I'm going to have little to say about this, for Asian American children, nearly, the overwhelming majority of them are being raised in two-parent families at all levels of education. Okay, if I look at the data in Canada, I can't get data as someone who doesn't have access to the Canadian microdata. I can't get this broken out by education, which is interesting. But I can see that the rise in lone parent families looks very similar in Canada as in the US. In fact, now the rates, this is 2011, the last year I could find data for, 65% of children are living with married parents. And as in the US, there's a really large share of kids living with a lone parent. Also, very interestingly, as in the US, this trend is being driven almost entirely by an increase in non-marital childbearing or parents who are never married, as opposed to an increase in divorce. Now, I don't have time to go into this today, but this actually matters for kids' outcomes because we know that children whose parents were at one point married and then divorced, they are much more likely to have access to time with their second parent or child support from the second parent. So the fact that unpartnered mother households are being driven by never married adults has an impact on the resource disadvantage of those affected children. Okay, like I said, Canada doesn't report the data by education group, not even to the World Bank, but I can get from World Bank data education on this education gap in family structure for the UK and the European Union. And there I'm seeing something similar to what we see in the US, where the dividing line is, the highest kids of the highest educated parents are substantially more likely to be living with married parents and substantially less likely to be living with a lone parent. Okay, so why this really matters and where the economics really comes in is that these diverging family structures are both cause and effect of widening economic outcomes. So there is a long literature about the changing economic fortunes of people with higher levels of education and lower levels of education. And what we're seeing is that has extended to the sphere of marriage and family. Okay, and so this, again, this divergence in family structure is both caused by economic divergence and it amplifies inequality. And that's really the topic of my of the book that I've written the manuscript, but you can't buy it yet, that Keith referred to in the introduction. Okay, so let me show you that there's the changing family structure of kids reflects changing marriage patterns. So what I'm showing you here is the decline in US marriage since 1980. And what's really striking is that when I go back to, since 1960, in the 1960s, 1970s, the cultural social revolution, marriage was declining for everybody. And then what happened around the 80s and 90s is that there was a divergence. And now college educated adults, this is men and women, are substantially more likely to be married than everybody else, okay? There's the leading hypothesis for what's happening here is the decline in the marriageable male. So both in absolute terms and relative to women, men without a college degree have seen their economic status, their economic opportunities erode. And we see that in both correlational evidence and in causal studies of what's happened to marriage rates and family structure as non-college educated men competed with imports from China and robot adoption in affected industries, okay? So we see both this correlational and causal linkage between the decline in the economic position of men without college, the decrease in marriage, and the rise in the share of children living outside, with just an unpartnered mother. Okay, finally, this is exacerbated household inequality, which is a point that I think is very much underappreciated. So in the top panel, I'm showing you that households, if I look at only households with two parents, what we see is rising inequality, which has been well documented. Okay, so households headed by someone with a 4-year college degree, their income has gone up by nearly 60%. It's basically been stagnant in the middle, just an 8% increase. And those at the bottom have seen their household income fall. All unpartnered mothers are doing better than in the past. Okay, women's economic position has increased across the education spectrum. When I look at all families with children, so now I'm not conditioning on 2 parents, but I'm allowing for both things to happen: widening income inequality and the divergent family structures. What we see here is that actually middle-class households have seen their household income fall. And why? Because what's happened is they've had essentially stagnant earnings with a rise, a sizable rise in the likelihood that they're running a household by themselves. And 1 earner is less than 2. Okay, so that's why households that aren't headed by someone with a college degree are actually doing worse when you allow for the divergence in family structure. All right, this has implications for kids' outcomes. It widens inequality. Kids have different levels of resources, which means different opportunities. And we have lots of evidence that that translates into lower, widening gaps in educational completion, likelihood of attending college, adult earnings, the likelihood of being married as an adult. And so the real reason why I think this is critically important for us to acknowledge and think about how to address is that this is threatening social mobility, and it threatens to perpetuate class gaps and inequality across generations. Okay, so I'm going to wrap up. Lower fertility, the decline in fertility, has all of the implications and potential challenges that I mentioned: a smaller working age population, potentially less economic growth and innovation, lower standards of living. The decline in 2-parent families and the widening class gap in family structure amplifies inequality and threatens to dampen social mobility. And I'll stop there.
Okay, well, thank you very much. There's a lot there to digest and discuss. I apologize to our participants. I forgot to mention that for the Q&A session, we're going to rely on the Q&A feature in the Zoom at the bottom. So rather than the chat function, if you could put your questions in the Q&A, I will draw on them and be your voice in asking the questions of Dr. Kearney. Now, it may take you a few moments to start thinking of questions, so let me ask one, and I think it's a question. Often it's
a comment. It's a comment.
It may be a comment. So a comment that's often attributed to Auguste Comte is that demography is destiny. And as I listened to you, and especially as I listened to your evidence about the relatively small impact of policy variations on birth rates, that maybe Comte or whoever said it had it right. So so there's a 2-part question here. Am I right in thinking that you don't see levers that government policymakers could turn to that would be effective in changing birth rates? That's the first one. Second one is, if we are skeptical about policy as influencing birth rates, is there any reason to assume that policy interventions would be more effective in changing marriage rates? Right?
Right.
You didn't actually, you didn't ask that question. Anyway, 2-part question.
No, I think these are really important questions. So I am skeptical that the kinds of policy initiatives that are sort of within the realm of political and policy conversations today, like, a $1,200 child bonus, et cetera, I am skeptical that those would meaningfully increase rates of fertility. But I want to be careful because I do think, on the margin, they'll move some people. And so, we will see some effect. But I don't think we can expect that a few $1,000s a year is going to dramatically turn this around or bring US childbearing rates back up to, 2 or 2.1 children per adults. Now, I don't want to be totally defeatist. What I really mean is incremental policy changes won't matter. If we dramatically changed our social and economic landscape, so it wasn't so having children wasn't so much in conflict with pursuing career or even leisure time, if we had a much more robust childcare system, if we had an education system that was more compatible with work schedules, if we changed social norms so that there was more equal gender division of household and childcare responsibilities, if we looked more like Scandinavia with the US exceptionalism in terms of a historical desire to have more kids, maybe things would turn around. But that's a dramatic change in society that I think would be required. And I'm not even sure that would be sufficient, but that's what I think would potentially have to happen. Now, I should note that Japan has quadrupled the amount of spending they've been doing in recent decades on these kinds of child-focused policies. And they did turn around their decline in fertility and increase it. It's still, far below 2, but for a large share of GDP, that may have been the precipitating events that stabilized their decline in fertility. So I don't know if you take that as an optimistic or pessimistic read of the promise of policy. Your second question about policy affecting marriage rates, my answer is similar in that I don't think there are any incremental policy reforms that would do it. So, for example, in the US, our tax system is progressive and family-based. So it's really unfriendly to two-parent working couples, or I should just say working couples, okay? So if you removed that tax feature, so there wasn't such a tax on married working spouses, again, maybe you'd get a little increase in marriage, but no incremental policy reform like that is totally going to turn things around. In a similar way to the way I responded about fertility, if we really invested in the economic outcomes of non-college educated workers, such that more men in particular were viewed themselves as more reliable economic partners, spouses, and dads, I think that would, potentially have an impact. But given we're in a totally new social paradigm now, where the social norm combining childbearing and marriage has been essentially decoupled outside the college educated class, I think the economic changes would have to be met with social changes and changes in social norms to see a really large reversal of these trends.
Okay, well, thank you. I'm going to put that down as very qualified optimism. But
okay, good.
So I'll ask you one more, and the questions are building up, and I will turn to the Q&A list next. I was quite struck by the year 2007, the recession. In the US, figures on birth rates. It was really quite striking, and I'm a little puzzled about why. What was 2007 some sort of in itself a precipitant, or was it simply an accelerator? I mean, it is actually quite a striking turn. And I ask that in part because the 2007 recession was less deep and less long-lasting in Canada. It's not that we opted out of it, we didn't, but it was much less dramatic. And we did not have anything like the meltdown in the housing markets, the loss of accumulated wealth, or whatever wealth the poor members of society might have accumulated. I mean, I don't want to diminish it, but the impacts were simply not the same. And so we have a similar pattern, as you pointed out, in birth rates, but we didn't have, I'm not sure there was a 2007 effect. So
yeah, this is really...
what exactly was that?
Yeah, that's really interesting. And I only recently started looking at the comparisons across countries and what happened with the recession when I was studying what the COVID pandemic was doing to fertility rates. And so it turns out that basically there's an empirical finding. I found this in multiple papers, others have found this. Basically, in the US, a 1 percentage point increase in the unemployment rate reduces fertility by 1%, the fertility rate by 1%. And that has been seen across recessions, okay? And we even saw like basically the same estimated relationship in the early parts of the COVID pandemic when our unemployment rate spiked. Now, there's a really nice paper showing that in the UK, the effect of the recession on the Great Recession on fertility rates was more muted in the US because their monetary policy countered some of the effect. And so now I've been looking with a co-author, and what we're finding is that the recession, the link between unemployment and birth rates, which is a well-documented fact, the pro-cyclicality of births, the link between a rising unemployment rate and a declining fertility rate really seems to come from liquidity shocks, people having less income, right, when there's an economic downturn. And when you mute that, you don't get such a large drop. But as you said, what's really striking in the US is we would have expected that, but then when the labor market recovered, we would have expected a bounce back. And so I don't know if somehow this accelerated trends. It's really, that would be unusual. That didn't happen in previous recessions. And as you said, deeper recessions, which is why I'm really pushing on this cohort explanation. Like that is when adults raised in the early 90s as compared to the late 70s came of childbearing age. And so the recession effect, some sense might be a distraction. And then the question, right? But I can't say that it's not some hysteresis effect. I just have no reason to think there would have been a hysteresis effect.
Okay, thank you. I'm going to turn now to the questions in the Q&A. And first we have one from Andreas Skaberskas, who asks, how important are regional differences in fertility rates? I guess in the US or in other countries.
Yeah, I mean, what we're seeing across other countries is that this is happening in high income countries. Fertility rates are not falling in Africa, but they're falling in much of Europe and North America. I should know more on South America, but I don't know if there's variation among the South American countries. In the US, we're seeing fertility decline across the US. By the way, this wasn't the question, but the changing family structure is happening in equal measure across regions of the US, which is also interesting because we have very large regional differences in the US in all sorts of cultural, social, economic ways. But there are larger decreases in the parts of the US that have a larger Hispanic share, which isn't surprising given that we saw that the declines in birth rates among Hispanics in the US have been particularly large.
Okay. So Laura Walsh has a couple of questions. The first one is, you indicated near the beginning that more people is productive in the sense of more ideas and higher income per person. Is that only relevant to higher income countries? For example, thinking of large population, low income countries like India and China. Yeah,
I mean, so that's a really good question that I wonder about and don't have a good answer. I think this gets to your point about demography being destiny. It doesn't have to be that way. High income countries tend to be generators of the biggest technological advances. Is that destiny? Does it have to be that way? I don't think so, which is why ultimately I make this observation that we should be investing in human capital of everybody and basic science. And so then we will, ideally, even if working age populations in high income countries are shrinking, the world doesn't suffer from an innovation loss.
Okay. I have a question from an anonymous participant who asks, how much does climate change and environmental concerns affect the fertility rate? as in having a child is now an ethical decision.
Yeah.
And here I'm quoting, they will experience the future horrors of climate change.
Yeah. So this, we get this. So I get this from my own students. I had a graduate student I was talking to, and she said her environmental professors in undergrad told her, they told the class, if you really care about helping the environment, don't have kids. So I anecdotally, it seems to be that young people have gotten this message. This is why I made the comment. I mean, I've looked at what climate scientists say about whether that's true, and that does not seem to be near the top of the agenda for climate scientists. Nonetheless, I take the question to be about, are concerns about the climate and concerns about the human impact on the climate leading people to have fewer children? Ezra Klein suggested as much in a recent podcast. Maybe the participant heard this. So Phil Levine, my frequent collaborator, we went and looked at the data on this to see, is it true that worries about climate change seem to have been rising as much as maybe anecdotally we think they have? And does it look like the places where we see on surveys people expressing more concern about the climate, do we see fertility rates falling by more? We don't see that in the data. We don't see any sizable increase in worries about climate around 2007 or the impact it would have. So I don't have evidence in favor of the idea, but anecdotally, we keep hearing from people that this is why they don't want to have kids.
Okay. Wei Ding, a member of our economics department, asks the following. Japan and immigration is aging Japan without immigration is aging and shrinking quickly. Would you say that immigration is the key factor in population growth for high-income countries?
It certainly seems like the obvious answer, at least in the short term, when there is still a supply of immigrants looking to move to high-income countries. This is, in the data I showed at the beginning of the talk, it looks like Canada has benefited from this. As you may know, immigration is a very politically contentious issue in the US, and our immigration system is, to put it bluntly, a mess. And so in theory, immigration is an immediate answer for countries facing a shrinking population. In practice, that's harder to politically implement in some countries than others.
Okay. Laura Walsh has a second question. Do you think there's any chance that there's a biological contributor to declining fertility? Is there a chance that women's fertility is in effect decreasing? And there's a lot of, this is my add-on, there's been a lot of discussion about the decline in male fertility as well. So yeah. Is there any biology going on here?
Yeah, I'm blanking on the name of the woman who has written a book on this. I wish I could remember. There's certainly a line of thought that, again, my non-expert read of it looks plausible as a non-expert, that there's a decline in fecundity, as you said, Keith. Mostly it looks like coming from men. I think that's really intriguing. So I should acknowledge that I've talked about the issue from a very economic decision-making framework. And I didn't, this was an omission, an accidental omission. I didn't acknowledge the uncertainty of fertility, that there are people who want to have kids who can't, there are people who don't want to have kids who do. And so my framework was a bit glib in suggesting that most of this is being driven by a decision-making framework. To the extent that there are declining fecundity issues in high-income countries, that would amplify this. And I'm certainly, my read of that is open to that being a possibility.
Okay. Wei Li has another question. The context under which the demographic changes in the US, Canada, and China, etc., is that scarily fast increase in a global population is less than 100 years from 2 billion has moved from 2 billion to close to 8 billion, how should we talk about many countries falling fertility rates when total population is ballooning?
Yeah, so obviously there has been since the 1800s worries about overpopulation, right? And this goes back to Malthus worrying that we were going to run out of food. And of course, what Malthus didn't anticipate was that there'd be technological advances in agriculture so that we could feed the growing population. And so I've always been a bit skeptical, frankly, of the overpopulation worries, given the potential that humans have shown for making technological advancements and innovation to accommodate growing population. But having said that, the declining population issues that I am talking about, or that I talked about, are problems facing high-income countries. And I recognize that that's a very different context from what's happening in less advanced economies, and their demographic challenges are completely different.
Okay. Kathy Blurk Kelly asks, is probing yet another variable that you didn't integrate in your discussion. She says, she says, they say, can't help but notice that iPhone was introduced in 2007, Facebook introduced in 2003. There seems to be a, quote, consumer preference issue since then from social media. Could social media be a driver of the cohort effect?
Again, this is another correlation that people have noted. I find it intriguing. I have nothing empirical to say about it, other than I have seen data showing that, in 2007, in particular, teenagers' behaviors have changed. So teenagers basically are engaging with each other less, which also means they're having less sex, they're going out more, they're going out less, they're doing less risky things. I've seen that for teenagers. I've seen survey evidence suggesting that even adults are having less sex post introduction of the iPhone. Again, I think that that's a plausible additional factor that might be amplifying the broader trends that we're seeing. I just don't have anything very compelling to point to in the data saying, aha, I could see now that in places where the iPhones rolled out, where more people are engaged in social media, that's really where we've seen fertility plummeting. And again, I want to go back to, I think what's really noteworthy is that the US just seems to have been slow to converge to the lower level of fertility in other countries. So I don't think it's something US specific, even though our fertility rate has been declining since 2007. I think the reason for low fertility in the US is probably not something just US specific, since we saw this happen in other countries like Canada in prior decades, right? So in some sense, the question that I've come to, which I have no answer for, is why did it take American women so long to figure out that it was so hard to combine having kids with all these other things, such that American women kept having more than 2 kids for so long? But anyway, that's not to discount a potential role of social media and the iPhone and all these things that we seem to know have reduced human interactions. But I think there probably is something broader happening across cohorts that's common across countries and not specifically tied to something that happened in 2007. Does that make sense?
Yeah. So I'm gonna ask a question. So I'm a political scientist by training and vocation, and so I'm going to ask a political question. What are the political incentives for anyone to care about this issue, right? Yeah. So there are lots of issues out there which may be have important potential effects, but don't get picked up in politics because either there's no political payoff in doing so, or it's a potential political hot potato, a potential third rail, a potential sensitive issue that can only burn people.
Yeah.
So let me finish the question. Right. So
it gets worse.
Well, we know in the United States that there's what people often call culture wars. Right. So in the context of culture wars, are there any political incentives here for people to pick up and run with this, to run away from it? What are the implications of the political context of the US at the moment for a dispassionate or careful analysis of these issues and discussion?
Yeah, no, it's a good question. We do have these awful culture wars in the US, which I think has stymied public conversation and political movement on these issues. We've already alluded in this hour to the culture wars really around immigration, which makes, is in the backdrop of all of this. If we look at fertility decline, it's interesting because here you see both people on the right and left caring about it in often using different language. So, for example, some more progressive politicians will say, we've made it way too expensive and hard for families in the US to have kids. And this was some of the rhetoric around some of the proposals in the Build Back Better that would have expanded family leave, had subsidized childcare. This was all about making it less expensive for families and part of a social welfare state. Okay, so that's often coming from so let's say the more progressive group, and then you'll have folks more on the conservative side who will explicitly argue for a pro-family agenda. Okay, so like Senator Romney has a family allowance plan out there and suggests that one of the good things that will come out of that is increased fertility. Now, here comes the culture wars, and then folks who don't want to side with or give any credence to an argument from a social conservative then automatically say, oh, now you want to force women to have kids. And so then you get into this other layer of like, well, the government should be agnostic about women have kids or not. And so it seems to me like there's a place for everyone to come together and say, hey, families need more support. And the progressives like that for some reasons, and the conservatives like that for some reasons. But look, everybody could get behind that. Somehow our political system is dysfunctional enough that people retreat to corners instead of coalescing around that. But that's one where I think you might have strange political bedfellows, but we should be able to make progress. On the family issue, this is a total hot potato, which is why I think this hasn't gotten nearly enough attention. And in fact, when social scientists started talking about this in the 70s and 80s, when rates of single parent families were far lower, it was really shut down right away. And so I think it's important we bring it back because now the rates are really high. We have decades of evidence that this disadvantages kids and leads to class gaps. But to your point, there's very little political payoff to focusing on this issue. And here's the real cynic in me, because the real people who are harmed by this are kids. And certainly in the US, I just don't think we'd have nearly enough political advocacy on the part of kids. And so that one, it seems like it's probably more cost than political benefit to talking about it. But again, I could be cautiously optimistic that ideally both folks from the cultural left or social cultural left and right should come together and say stronger families are better for everybody and everybody benefits, and we might get there from different reasons, but ideally we'd all be able to agree on that.
Well, I think we've exhausted the question list, and we've probably exhausted you. I found it personally fascinating. And so I want to thank you very much on behalf of the School of Policy Studies and the wider Queens community who have been engaged with you and have enjoyed a fascinating conversation. So thank you very much. And we wish you well with your book, and hopefully it'll help create that sweet spot around investing in families. Thank you so much for coming.
Thanks for having me. These were great questions. I really enjoyed this conversation.
Okay.
Thanks.
Well, nice to meet you. Bye-bye.
Bye.